Hi, it's Dan Harris of Profits Marketing Group, and we're here today talking with Dr. Joseph Aiello from San Diego Center for Integrative Medicine. Thanks for sitting down with us today, Doctor.
Thank you.
Would you tell us a little bit about your practice, how long you've been around, and so on?
Well, I started practice in 1991 in Spring Valley doing family practice, and then was doing general practice at that time, and eventually learned to do some acupuncture in the year 2000 and learned that there are other ways of doing medical care, learned some Chinese medicine techniques. Later on, I learned from a naturopathic doctor in 2007 that there's even other ways of doing medical care, and have grown it since then. We moved from to La Mesa in 2013 and have expanded since then.
Great.
Doing the San Diego Center for Integrative Medicine.
Well, now, okay, perfect segue. You practice integrative medicine here. Tell us a little bit about the difference between integrative medicine and what is more the traditional medical model.
So integrative medicine, so basically we're trying to integrate the different medical modalities into healthcare for patients. When I was practicing by myself, it was difficult to take care of the patients. I would make recommendations such as exercise, diet modification, and things like that, but it was very difficult for me to do it for myself. So now what I've done is I brought in a nutritionist who will then help me to modify patients' diets and their routines. He can give them an exercise routine. I have a physical therapist now that will help with any kind of physical ailments, which has been a great bonus to the practice. And now I'm very excited because we've actually added a licensed marriage and family therapist.
Wow.
Because I think a huge part of medical care and actually getting people well is to take care of their mental and emotional and spiritual side. And now I brought in Sandra, who will be helping with that, and therefore we can integrate the whole care for the patient, which is their physical, their mental, emotional, and spiritual side.
Right. So
and
literally
that's total
treating the
care,
entire patient,
integrating all of those modalities.
That's great.
Which has been a benefit to patients up to this point, and I think now adding Sandra is going to be a bigger bonus.
Sure. Well, excellent. Now I know that you practice what is called regenerative medicine.
Yes.
Tell us a little bit about exactly what it is and some of the different techniques.
Well, regenerative medicine sort of goes along the lines of how I feel about the health of the human body. The human body was designed to heal itself, and for whatever reason, people become ill and they cannot heal themselves. I think stress has a large part to do with it. There could be physical injuries. Regenerative medicine will address the physical injuries that people may have. So, for example, if someone injures a joint or sprains a ligament in their lower back, we use regenerative medicine to help heal those injuries. So, if someone has a lower back injury to the sacroiliac joint or a knee sprain where they've damaged a collateral ligament, then we will take the platelets, which are circulating in their blood, which the body uses to generally heal injuries, and we will concentrate those in a centrifuge, and then we will inject those into the site of injury. And they literally will regenerate those damaged tissues.
Wow.
And we've even gone a step further, and we now will harvest bone marrow from the back of the pelvis, and we will then concentrate that and inject it along with the platelets into different joints to get even stronger healing. It's been phenomenal. We've been able to heal up meniscus tears, and working with that, and the patients have been very pleased with it.
Great. Well, now you answered part of my next question, but so who might be a good candidate for regenerative medicine?
Regenerative medicine is basically anybody who's injured a ligament or a joint, and it could be any joint in the body. I've injected virtually every joint from fingers to elbows, knees, lower back, shoulders. It could be a short-term injury or it could be a long-term injury. I had a patient who was in his 80s who had injured himself back in the 50 years ago, and we were able to treat his back and get him about 90% improved with his pain.
Wow.
So it doesn't matter how long the injury is or how old the person is or how young. There is a reason why they haven't been healing, and we are going to help to start that whole healing process over.
That's great. So, for example, even maybe somebody with advanced osteoarthritis.
Yes, absolutely. Osteoarthritis is the ligaments have become strained and stretched, and the joint is sort of wobbling and wearing itself out. And with the platelets, we can inject them into the ligaments and tighten them up and help to stabilize that joint, which helps reduce the pain.
Right, great. Are there any side effects, any issues with?
The main side effect is discomfort.
Okay.
So some discomfort with the injection, and then some discomfort and pain after the injection, because we're actually recreating the whole healing process, and the first part of that healing process is inflammation. And this can be a dramatic inflammation, which can cause a considerable increase in pain. It generally resolves over 24 to 48 hours. People they do their regular activities. There's no restriction except for no strenuous activities for about a week. And other than that, it's a very safe procedure because we're actually taking their own products in their own blood and injecting those.
Right.
We're not injecting anything that's synthetic
medications,
or
yes,
outside of their body.
And that's interesting. You mentioned inflammation. Generally, lay people like myself think of inflammation as a bad thing.
Right.
But you're telling us that actually it's...
No, the acute phase of healing is a strong inflammatory response. Platelets go in, they plug up any injuries, and then they release growth factors, which are inflammatory. And those growth factors help to bring in new cells and stem cells that actually help healing. Therefore, one of the reasons I think why people don't heal, and they wonder why they're not healing, is probably because they're taking high doses of anti-inflammatories. So I discourage my patients when they're injured to not use anti-inflammatories, to rest and use Tylenol, and I think the anti-inflammatories will stop the healing process, so stay away from those.
Okay, excellent. Well, anything else that you'd care to add, or
No, I just want to emphasize that the basic idea of the center here is that the body can heal itself. And what we do is we want to help we figure out where the patient needs help, and then we give them a roadmap of how to actually go about starting that healing and completing the healing.
Great.
So we will stick with the patient until they get it done.
And without surgery and medication.
Yeah, we try to do it all naturally.
Oh, perfect. Well, thanks
Dan.
again.
All right,
Appreciate it very much.
appreciate it.